everyone, welcome to my channel Radiant Living. I am Dr. Pramod Joshi, MD Medicine, practicing last 43 years. Sometimes you come across a situation where someone around you suddenly collapses and you don't know what to do. So I have come out with a video where every second counts. Jeevan Sanjivani, that is COLS, saves life. Here you will learn about Jeevan Sanjivani in 5 simple steps. Jeevan Sanjivani is part of basic life support. To elaborate on this knowledge, I have invited Dr. Bhavesh Seth. He is a president of anesthesiologists in Pimpri Chinchwad and he is practicing in PCMC for more than 20 years. Welcome, Dr. Bhavesh.
Thank you, Dr. Joshi, for kind introduction and giving me the opportunity to share my knowledge on this platform.
My first question to you is what is basic life support or cardiopulmonary resuscitation? We call it CPR.
So, cardiopulmonary resuscitation or CPR has two components, cardiac and pulmonary. But recently, ICMR has come out with the guidelines where compression only life support or COLS is sufficient for the management of a victim with cardiac arrest. ICMR also provides stepwise approach by anyone for the management of the victim outside the hospital to get the optimum outcome.
Said CPR has two components. One is cardiac and respiratory, but COLS is only covering cardiac resuscitation. What about the respiration?
Good question. COLS has only cardiac part, that is true. But during compression, the air is exhaled out and during the recoil of the chest, it is sucked inside. And at the same time, outside the hospital, giving the pulmonary resuscitation, the only method is mouth to mouth breathing, which is no more practiced post pandemic era. And also, it is very difficult to give it by an untrained person.
Understood? As you explained. Today, you will learn about Jeevan Sanjivani in 5 simple steps. Do watch this video till end and share it with your friends so that somebody's life can be saved. Dr. Bhavesh, can you explain when COLS is required?
Yes. So whenever you find a person who is not responding or in a collapse condition, you can give compression only life support. There are various reasons. Here I would like to highlight that there are various reasons like hypoglycemia, epilepsy or hypertension and cardiac arrest. Sir, as a physician, can you elaborate more about it?
Oh, sure, certainly. In hypoglycemia, there is low blood sugar, and because of that, the person becomes unconscious. There is sweating, cold, clammy hands, but the pulse and respiration are usually well maintained. And after administration of glucose, they quickly regain the consciousness. The second is the epilepsy, where person after fits is definitely unconscious, but pulse and respiration are well maintained and he recovers slowly over a period of half an hour. The third is the hypotension where blood pressure is low and it can happen due to severe bleeding due to accident and pulse is thin, patient is pale. Here, if the leg is not injured, you can raise the leg, the BP will little come up and may person regain some consciousness. And the fourth and the most important is cardiorespiratory arrest, where the heart stops beating and due to some conditions like heart attack, accidents, burns, drowning, etc. Here the COLS is required. Can you elaborate on COLS?
Yes. So basically, cardiac arrest means there is complete stoppage of blood circulation and oxygen supply to vital organs like heart, brain, kidney and lungs. So if this circulation is not restored in 3 to 4 minutes, there may be the damage to the brain starts, and after 8 to 10 minutes the damage is permanent. So after 10 minutes, even if the person regains the heartbeat and circulation and respiration, he may live in a vegetative state. So by now, you must have understood the importance of starting the COLS as early as possible.
Can you explain all 5 steps how codes can be performed?
Yes, I will demonstrate it on a model. First thing I want to highlight that COLS can be performed by anyone and anywhere. My son Gaurav is with me, he is 15. COLS has 5 steps. First step is check for the scene safety for yourself as well as for the victim. Victim may be near fire or live electrical wire or in the middle of the road. Take him to the safe place. Second step is check for the response. You can tap on the shoulder and ask for his well-being.
Uncle, are you okay?
You can also check for the respiration by putting 2 fingers near nose, and you can also check for the carotid artery which is lying 3 cm lateral to the midline. You palpate it with the 3 fingers near the windpipe, but don't waste more than 10 seconds in finding the pulse. Now third step is call for the help. Since there is no response, so now you know that he needs basic life support. For that, you can shout to the nearby people.
Help! Someone help, please!
You can dial 108 and tell them the situation and share the location. You can also call nearby hospital for getting the ambulance. Now fourth step is clearing the airway. For that, you have to make sure that the victim is lying on the flat surface on his back. Now open the mouth and check for any vomitus, blood or secretions. Clear it with the handkerchief with the index finger. After clearing the any secretions, you can open the airway by tilting the head down and lifting the chin up. Now the most important fifth step, compression. For that, you have to first identify the sternum bone which is lying in the center between the 2 nipples. After identifying the sternum bone in the chest region, you have to put the heel of the dominant hand over the lower half of the sternum by placing the other hand on the first and interlocking your fingers. Now, after placing it, you straighten your arm and position your shoulder so that it comes in the same line with the hand. Now start giving the compression by pushing it firmly down. It should be minimum 5 to 6 centimeter down, and count it loudly.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
You give 100 to 120 compressions in 1 minute and allow complete recoil of the chest after each compression. After 5 such cycles of 30 compressions, you again check for the response.
Uncle, are you okay? Can you hear me?
But
Please
again,
respond.
don't waste more than 10 seconds to see the response so as we can avoid the long interruptions. So, push fast and push hard is the dictum for optimal outcome.
Excellent. Dr. Bhavesh, you have explained Jeevan Sanjivani 5 steps very nicely. If this boy can perform COLS, I am sure everybody should be able to do it. Can you explain me how long to perform COLS?
You can keep doing it till the person regains the consciousness and starts responding, and or we get the medical help with the ambulance.
One last question. When to stop it?
We can stop it if we are alone and exhausted, or we can, it's more than 30 minutes and the person is not regaining the consciousness, or if the scene is no more safe to continue with the course.
So now you have learned about all these COLS, and now you go through to sum up everything through these slides.
So this is a good initiative on the part of anesthesiologists to teach and train at various places like gardens, malls, police stations, schools, colleges. And as a president of ACPC, I am glad to inform you that this public awareness activity is carried out by various branches of Indian Society of Anesthesiologists as a part of celebration of World Anesthesia Day on 16th October.
Initiative. Dr. Bhavesh, thank you very much for explaining Jeevan Sanjivani. Now I hope with these 5 simple and easy steps you have understood COLS. So anybody can perform anywhere and become a lifesaver. I hope you must have liked this video. Do subscribe to my channel and share it. Don't forget to press the bell icon. Thank you.